With me now, Niall Dickson, who's the Chief Executive of the NHS Confederation. Neil, good morning.
Morning.
What do you make of this announcement?
It's a welcome boost. It's significantly more money for the health service than we've seen for the last 10 years. But, and there is a but, we've got to try and catch up or really get back to the situation we were in around 2009, and there's an awful lot of work to be done on that. And secondly, we face a really huge challenge in terms of the number, particularly of elderly people who are suffering from a lot of different conditions. Now that is a big challenge to the NHS to get it right, but it also means very significant extra funding. On the face of it, the independent report that we commissioned from the Institute for Fiscal Studies and the Health Foundation said 4% a year would be needed for the next 15 years. Obviously this is short of that, but it is a welcome boost and I think we should welcome it, and obviously our members will be wanting to work with government about some hard choices, what we can do and what we can't do over this period, and also how we start to change the model of care so that we don't just keep putting money into hospitals and then watch them really fall over because of the demand.
I mean, you make a point there about what we can do and what we can't do. What are some of those hard choices at this point?
Well, I think that there will be hard choices about where you put the money, and I think there is definitely a case for putting more money into the community services. We've not heard anything today about social care. Now, we've been told that social care will have its own settlement and that the government has taken seriously the heavy lobbying that we've done, which says you cannot simply put money into health without putting money into social care. So this plan, apart from anything else, will absolutely depend on the level of generosity, as it were, in terms of trying to get social care the right way round. Because at the moment, social care is frankly on its knees and it has not been funded well, arguably, for the last 20 years.
And the prevention of ill health needs to be a part of the picture as well, doesn't it?
It does. I mean, you can overstate prevention in one sense, because a lot of the issues that we're facing now is because of the huge success which the health service and indeed society in general has had over things like smoking. But of course people said, oh, if you prevent smoking you'll save the NHS money. Of course it doesn't. It simply means that people then live longer, happier lives, which is absolutely great, but they do then at the end of their lives or towards the end of their lives get other conditions and illnesses. But I do think prevention does have an absolutely critical role, for example in treating some of those people with long-term conditions who at the moment may go in and out of hospital numerous times because they fall ill or they fall or whatever, and actually managing them better at home or even in nursing and residential homes so that they're not going in and out of hospital all the time. That really is a critical thing that we've got to do going forward.
And just one curiosity, and I don't know whether you know the answer to this, but I mean clearly in 2015 there was a 5-year plan. Here we are in 2018, so we haven't got to the end of the 5-year plan and now we have another one. So does this supersede the one that was already in place?
Well, I think some of the work on that one will go on. I think there have been some successes in that, but I think we'd also have to admit, given the level of funding which we've had, we have not advanced as much as we should have done. And that's the big question about this amount of money. First of all, we've got to use it absolutely as wisely as possible. We're at one with the government on that. The question is, it doesn't reach the 4% that we think is really necessary. But of course, our members will have to work with this and try and make it work.
Okay, Niall Dickson, thank you very much indeed. A rescue ship which sparked a major diplomatic row in Europe when it picked up hundreds of migrants